Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back. Today we have with us Dr. Sue MacLellan-Tobert. It's lovely to have you.
Thank you.
Tell us a little bit about you.
Sarah, I'm going to start by telling you that I am someone who likes to nurture others. So rather than just my list of other roles in life, there's kind of this underlying theme for me that I've landed on, which is not so much taking exceptional care of people, but simply being present with them and doing what I can to care for them. And I saw that kind of rise up in my career in medicine, how I took care of my three now grown daughters as a mom, and in what I do now as a coach since retirement.
There we go. Tell us a bit about your medical career, what you did, and things you noticed about your career.
Sure. I'm originally from Alberta, Edmonton. I grew up in the Canadian prairie land and went to medical school at the University of Alberta. And at that time, my biggest draw to medicine was really around enjoying the science part of it. And there was some contribution in there that I felt toward taking care of people, but my love for helping children grew over time as I was exposed to different specialties. And I landed in pediatric residency at the Mayo Clinic in Rochester, Minnesota. And my husband was there with me at the same time. He's also a physician. And we trained there, and my love for pediatric cardiology blossomed during that time. And ultimately, I spent nearly 30 years as a practicing pediatric cardiologist in the Midwest.
There we go. Wow. Tell us about, because that's a long career. Tell us about what you saw about being a pediatrician and cardiologist from beginnings and as you moved through your career, because I'm sure that was a significant difference from beginning to end.
That's a great question. So first of all, I just recall comparing and contrasting Canadian medicine to American medicine. I think that was something that has really stood out to me over the years. But related to the care of children and how I practiced medicine, there was a big shift mid-career from functioning as an autonomous physician who was in charge of the team to us all being much more team-oriented and functioning as more of a kind of a maybe an amorphous entity where everyone had their contributing roles rather than the physician being in charge of the group. And as I clued in to that shift toward more teamwork, I really thought that was valuable because then I didn't feel like the Lone Ranger out there trying to guide everyone. So I appreciated that change up in medicine. And in later years, honestly, I really think that our autonomy as participating team members became less and less as medicine became a bit more corporate driven. And so then I began to notice that shift. And for me, there was an awareness around that said, Sue, this isn't really resonating with who you are anymore and how you want to practice medicine. And ultimately, that led to me stepping back, doing what I'm doing now.
Yeah, okay, yeah. Tell me about record keeping because at the beginning there wouldn't have been the big EMRs that you would have had come in at some point in your career.
Oh my gosh. So this gives me a chuckle. My worst call night ever as an intern at the Grey Nuns Hospital in Edmonton was on internal medicine, and I had 17 admissions, and I was the only intern, and that was all handwritten notes back then. And I had writer's cramp on top of being dehydrated and hungry and exhausted, and there were no rooms in the inn. So I'm calling all around town to try and find beds for these poor, desperate patients. And so I will never forget that night. And I am one of 11% of physicians who is not savvy at typing. I am a four-finger typer and I can type 18 words a minute. And even when we started to get into the electronic medical record, so shift from handwritten to EMR, bless my institution's heart, they wanted us small number of us to do the Mavis Beacon typing program. I tried my hardest. Old dog, new tricks. I don't know. It wasn't going to work at all. And so I just stuck to my four little fingers. Somehow that got me through. And thank goodness I could do the little phrases and templates and all of that. But I'm a big believer in efficiency. So, as much as I like to tell stories, I know I came to that realization early on that the medical record was just a game, and I needed to play the game in an efficient way to get it done. And like one of my little tricks I tell students is choose one fun thing to put in the chart in your opening assessment about the patient so that if the patient reads your record, they know that you paid attention to their funny logo shirt or their crazy hair day or something like that. So you get that connection with the patient, but then you just have to simply meet the needs of all the other people that are requiring you to document properly. But efficiency is a key. Huge shift over the years.
Got it. Okay. Yeah, absolutely. You talk about team like it was a blessing when it started. Tell me about what team looked like for you from when you were leading the team to this time that it was actually a good thing that was happening. What did it look like from a patient perspective or from your perspective to actually be part of that early process of team?
Sure. Yeah. What I relished about the team is, and this was a phrase that I used over many years, many times, that all together we made one brain. And so we were really complementary to one another in our roles, in our actions, in what we brought to the final product for the patient. And so I think that the patient was also part of that team, and they began to learn, the ones that you followed for a long period of time, they began to learn how vital their role was too, bringing the information that we needed, showing up on time, being present. They learned to trust the nurses that I worked with and the medical assistants. They knew the check-in people. And I really, this is just maybe how I'm wired, never held any single one of us, including myself, in higher regard than the other. We're all contributors here in a very vital process, and each of us is coming with our own set of gifts and talents. And I think that as I modeled that attitude, that caught on with the team. And within our section in pediatric cardiology, it was good. We had a wonderful time. And even up until I retired, it was that way. It's just what we could do, the ability for us to function independently was becoming more and more limited.
Who led that change? Did it require somebody identifying we need a check-in nurse, we need them to do these pieces of
Mm.
the assistance, we need these ultrasound techs, whatever it looked like to set up this team in the right way? Who was
Mhm.
leading that, do you think, back then?
Typically, it would be an administrative leadership role. But you bring up an interesting idea in all of this. In medicine, we live in a really complex environment. And so it takes a number of different layers of teamwork for that to work well. And I began to see the phenomena arise where we were now doing agile and lean, and we're trying to be efficient and limit roles and cross train, et cetera. So, what ends up happening when you say now every clinician must have 15-minute blocks for their average appointment, and we put them all into this same simplified approach in a very complex system, it simply doesn't work. We need complex solutions for complex systems. And so as I began to witness that more and more, it created a friction inside of me that I don't think we can all be put into the same cubby in the same way with all of the different things that we're doing. And what had been an honoring of that diversity of tasks no longer existed. And that was a frustration point.
So that was the team that was working well became the system and team that wasn't working well.
Yeah.
That ultimately led to you saying, you're not appreciating what I need within this team. I
Mhm.
can't work in 15-minute blocks. That's not how this whole thing works. You're not listening anymore. Is that kind of the
It
what
is
you were.
kind of that. So, yeah. So, for instance, if I had a very complex cardiac patient that I was seeing where I knew it was going to take me an hour and I see them once a year and we have a whole list of things to do, and I'm being told now to do that within 30 minutes, and I'm just being told, right? First of all, grown-ups don't like being told what to do. So, that was one observation. But the second is that doesn't jive with best patient care, no matter who you would ask across the board, not just my opinion. However, the plan is, and that's what we're told, now you have to do it in a shorter amount of time, sometimes with less support staff as well. So there began to, I think, be a breakdown in the system as the system was trying to move toward efficiency and simplification and standardization. Impossible to do that, I think, in medicine because it is a complex entity.
I hear that. Less support staff. Because you're like, what was working was this amazing team. They were all working top of scope. We let them have responsibility. They had
Mm.
their roles. They knew how to take care of their patients to this system where we had less support staff and less
Mhm.
time. We're told we had these concrete, and I'm an adult and I don't like being told what to do. And I think it's more than that. It's you are an expert. You have this huge set of skills. You know what's required in the. And sure,
Mhm.
there's some curbing of what extra nurturing could
Sure.
be done to get the meaty tasks of today done for this patient. But it's still not going to fit in 30 minutes or 15
Right.
minutes. And that
Yeah.
ability for you to say, this isn't going to work in 30 minutes and the system not hearing you. And it's not going to work with less support staff and the
Right.
system not hearing you. Okay, all right. So then let's hear what happened next. So what did that transition look like? Did you decide, all right, I'm out, or did it take a while did it present as a burnout story? What actually kind of
Mhm.
ended the piece of it?
So I think a lot of that change around efficiency and saving money and the bottom line, et cetera, cutbacks started to happen pre-COVID, right around COVID. And that whole encounter for all of us in the system that I worked in, the pandemic itself, created so much angst and stress and frustration and unknownness that we don't know what's happening next. And it was about a year before the pandemic that I became part of our wellness team at our institution. So that was around the time that burnout information was getting out into the literature. And I think our leadership, while trying to balance the bottom line, said, let's pay attention to some of this burnout data that's out there. Let's survey our providers. Oh gosh, boy, 53% of them are burned out. Now what are we going to do? Let's try an initiative. So they pulled a cluster of us who were probably in more leadership roles overall together, and we became our wellness team. But we didn't really know what to do. We didn't know what we didn't know. And so just on a whim, I happened to stumble across a coaching course that was just the basics in coaching. And I thought, I've heard a little bit about this. I'm curious about it. I headed off to Denver for a weekend and it changed my life, Sarah. I came back to the team and I said, there's something in this coaching style of communication that I think our group would benefit from. Our providers would enjoy learning more compassionate, kind ways to communicate. There's ways to respond better than react. There's ways to manage through our environment beyond what the burnout literature was saying, which is self-care, meditate, yoga, that kind of thing at that point in time. And I wrote a business plan. I said, I think we could develop an internal coaching program. And those weren't very common back in the day. And three of us then were sent off to be trained through the Physician Coaching Institute. And we came back and we developed an internal coaching program that was a very robust coaching program. Within 2 years, we served over 300 members on staff, which included associate staff and physicians. Nurses had their own separate support at that time. We offered a monthly newsletter on wellness. We did group coaching. And then the pandemic all kind of was in there too. It was actually fortuitous. We had the coaching program set up to support our providers in the midst of some of the greatest challenges that they had ever seen in any of their careers. And so through that is when having a coach of my own too, I really felt like I was growing into who I had always wanted to be, who authentic Sue was. And more, I began to realize that how I was able to practice medicine was limiting who I just really wanted to be as a person at that point in my career. And ultimately, several years later, it resulted in me stepping away from active medical practice. But I think the point in it all is that, like I said, you don't know what you don't know. So learning that there's a different way of communicating in medicine and how we can care for one another when we're under some of the greatest stress in a very high stress system with a high stress job. Those are things I never learned back in medical school. It's probably going to be different for upcoming generations, but I didn't feel like I was equipped before in that regard, and I had to go out and do the equipping of myself, and it was worthy of sharing with others.
Can you give us what a before and after looked like for either some of the participants before the pandemic or for yourself in that weekend course at Denver? What was it? What was the insight? What was the difference for the person receiving that coaching?
Hmm. I trained as a development coach. So, one of the things that was very important for us to share with our colleagues was that this type of coaching was not remedial. You weren't coming to us to be fixed. You were coming because you wanted to gain something, to move closer to your ideal self, to develop your career, to look at a different style of leadership, something expanding and forward moving. And so we had to break down that stigma of remedial coaching with our leadership when we started the program. And I think people at first started to come to us saying, my department chair said I needed to come and fix this issue I have with being too spicy of a communicator. But eventually, what shifted is people mellowed and they realized, hey, this is not something that is at all like therapy. It's not something where I come in broken and I walk away unbroken. I am who I am, and I get to know more about myself and have personal growth in the meantime. So I think organizationally, people began to understand that this was a real benefit for development, for personal development. And then, of course, around that time too, CME became a little bit more liberal about what professional development might be. So we could offer retreats where there was going to be CME credit now. And the rest of the world seemed to gel toward what we would be able to do within the coaching practice as well.
Okay, yeah. Tell us about how it's possible for physicians to get benefit from a wellness and coaching intervention when their institution's still telling them, no, you get 30 minutes or you get 15 minutes. No, you don't get extra support stuff. Like there's real agitation, annoyance, frustration, like you said, lack of autonomy, losing some of that autonomy. And they're saying, but we're going to put wellness in place. I can hear the audience going, ah.
Sure. Absolutely. Absolutely. So any systematic changes around wellness happen very slowly, if at all. And I think the statistic out there is that only 10% of wellness programs across healthcare are well funded. So still the money isn't being put toward programs like this. We're functioning off a bit sidelined. But what ends up happening is, although you might say during your coaching journey, okay, I can't change the system. What can I change? What do I have choice about? I have choice about myself. So, how am I going to show up? Is this where I want to show up? Do I need an entire shift? Interestingly enough, when we looked at our statistics internally, a number of physicians chose to leave after they completed the coaching program because now they know their values and they know their strengths. They can better articulate who they are, and they're moving on because they couldn't fit into that round peg in a square hole kind of thing anymore. So much of the coaching experience is around recognizing that you do still have choice in what you have in front of you. Is that a hill you want to die on or not? And what asking yourself, what do I have agency over? How am I going to show up? How do I want to show up? How do I want other people to experience me? How am I being present? What's my impact going to be? So it's a bit of a mindset shift. It's not a cure-all, and I don't think that coaching suits everyone, But for those who are interested, I think it really can be a little bit of a way to broaden your perspective around what might seem to be a restrictive environment that you do actually still have some agency over.
So there was examples of physicians who were being told this formula but decided to stay with that intervention.
I'm not entirely certain I understand your question.
Oh, it's okay. When I'm looking after physicians who are being redirected into this new way of seeing patients, sometimes there is that automatic, I'm out, I can't do
Yeah,
it this way.
sure.
And they have that, I can't see any way that this is ever going to be possible. It's harming me, it's harming my
Mhm.
patients, I'm out. Sometimes that intervention with coaching can look like, okay, but the way that you're showing up in patient encounters, the way you ask questions, the way you are navigating that appointment, infinite possibilities, and letting
Mhm.
them see that there are ways that you can survive within the system and still provide excellent care for your patients, but
Mhm.
it looks different to how
Mhm.
you've done it
Right.
in a different model of care. But it is possible if you want to stay within this system to still have an experience that you're giving quality of care for patients. 'Cause I think that's really highly valuable for physicians
Mhm.
and clinicians is they are
Mhm.
providing quality of care for patients and they are not being continually harmed by that system by having
Mhm.
to stick within this model. They're not adding homework because they're being forced into 30 minutes and now they're doing the work of the consultation in the evening. We have ways to adapt. How are you doing that work? What are you
Yeah.
doing differently in the consultation?
Yeah.
Showing them possibility of infinite possibilities within that model so that they can stay if they choose to. Like you said, it's a
Absolutely.
choice and not everyone is going to fit into that model. But I just wanted to have that perspective of it's not a will I stay or will I go? That's why I'm going to
Correct. Yeah.
coaching. It's, oh my gosh, this isn't what I signed up for. I'm scared. I'm scared for me. I'm scared for my
Right.
patient. I don't know what to do. I'm out of options. Let's try this wellness thing. Let's try this coaching thing and see what else is available before I just say goodbye.
Yes. Yeah, I would agree with everything that you've said. It is not a black and white, yes or no, stay or go type situation. And sometimes people find it easy to adapt. They are primed and ready and willing to try new things and experiment. Others will say, I'm so exhausted because of the system I've been within. I don't really know what to do next. That might need to be more of self-care and learning self-compassion, and that for a period of time before you have the energy again to start to change what's around you, caring for yourself first. So how I approach a coaching client is really around finding out from them what they want to explore, what goals they might have, what things they want to explore growing toward or changing within their practice or life. And then because they're setting the agenda, I'm going to facilitate that exploration with a variety of tools. And not every single coaching client has the same experience. And I think maybe you and I both know this too, wherever anybody arrives is where they're meant to be. And they'll take it from there and probably have learned some personal skills that they can even do a little bit of self-coaching with. Like, how am I going to move forward now? What might I do in this situation? What have I tried before? That willingness to experiment. But yes, it's such a, again, I return to that complexity of the system, and everyone's experience within it is going to be so unique.
What were the systems saying about the wellness programs and the coaching programs? What did they see that was of value to having these programs funded and within their organizations?
It is one of the approaches a system can take toward maintaining quality care, patient safety, employee engagement, and lowering potentially even rates of burnout. So I think that the organizations that I've worked with, and when I was working internally as well, they were primed to want to see some positive change. They really did care about their providers. I think they just didn't really know what to do to be of additional support. And again, most of them don't want it to do have a lot of extra cost to the system. So For those organizations that are really invested in well-being, you can see those groups of providers just flourish. And in fact, some of the programs that I've worked with, they have trained up a number of internal coaches, and the coaching team is doing such a variety of activities within the organization, really touching every practice and life in some way. So I think that the systems want to see a change. Now we're beginning to better understand, I think, nationally and even internationally, how we might provide better support. But fundamentally, it still has to be the individual's choice to want to participate. So we have the system bending to meet us. And are we willing to step up and explore that personal growth and development more on our own, if given that opportunity? Yeah, I'm not sure if that totally answered your question, but might have
I'm
gotten
going to
off
go
on a
back.
bunny trail there.
No, all good. I'm going to go back to nurturing. I think that what I heard was that the wellness programs, the coaching programs do help someone be heard, validated, listened to, nurtured. And I know that when we keep that frustrations about what's happening in the system, what's happening in our work life to ourselves, that's hard. When we get to share it with someone, that's better. When we get to share it with a peer or somebody who understands, it's even better, especially if that person then has tools and training and experience to help further that. So help that conversation be even stronger, better, and more focused on, I hear your story. What do you want to it? What do you want? What do you need? And hearing that expression of exploration of what do you want to achieve within what you've just told me? Not problem solving necessarily, but just the what would be an outcome from this? What would you want to work towards about this?
Yes.
When you've had those institutions who've then internally trained physicians or providers to be their own internal coaches, that's another layer to that person's busy day already. What have
Mhm.
you noticed about that? Is it something that is picked up and lots of people want to do that? Is it a few people? What is their experience of working and adding coaching to their repertoire? Have you seen that perspective?
Yeah. Interestingly, most institutions will balance it out as part of the FTE. So, for instance, if somebody gets zero point 0.4 FTE for research time, they might get something along those lines for coaching. When I was working as a coach, we each had zero point 0.1 FTE. So together that totaled, we ultimately had 5 coaches. That was a half of an FTE dedicated to coaching, and each of us had a half day a week where we could do that. So it is a bit of a balancing act whenever you add a different duty like that into your role, but it's definitely possible. And then some institutions contract with coaches externally and they'll hire them in to be available, right? So there's a lot of different ways to slice and dice it. But most of the time, when an organization is coming to say, we're willing to make a commitment to an internal coaching program, they're going to align it with having the coaches, coach, physician, provider, whatever their role is, also. Some of that will be used up as an FTE for coaching. So it works out, I think, pretty reasonably well.
Got it. Okay. All right. That makes sense because I'm thinking to add another role to somebody's position
Right,
adds more time and more
right,
commitment. And
right.
obviously you have to catch up with those people during work hours, presumably.
Presumably, yes. So that's an interesting question. The logistics of being an internal coach are a bit challenging at times. And so we would structure it where we would be available earlier in the day, middle of the day at lunchtime, sometimes some early evening hours. So we wanted to be available for the people who wanted coaching. And if they wanted it in the middle of the day, we had a half day set aside each week where we could do that as well. And the institution was balancing it by saying, if you're going to go for coaching, we're going to work with you in your schedule so that you can do that. And so typically it would be late morning, noon, or early afternoon type appointments. And we would do 45-minute sessions virtually with our colleagues. That seemed to be the easiest. We were spread out over several different clinics as well. There's creative ways to do that, and the institution has to be willing to be open to what you're trying to experiment with that way.
Got it.
Yeah.
Was there a cost to the physicians or clinicians who were engaging in this
Yeah.
program?
At our internal program, there was no cost. You bring up an interesting point, though, because this was offered free. They could come and embark on a coaching journey with a coach, but sometimes there wasn't a lot of incentive there to continue it over time. In other words, it's been my observation with clients who come to coaching where this is now a personal investment for them. They're typically all in and committed to doing that. Whereas the internal client, and I've seen this at a number of institutions, you might offer them for this challenge that you're presenting with, we could do 6 sessions, a bit of a coaching arc together. And sometimes the client, maybe partway through, is not so interested in continuing the commitment. There's other things that are taking their attention, and there's no investment that they've had to put forward into it otherwise. So there's a balance there you want to find, but there was no cost to our program.
Yeah. I know that as a busy physician working, seeing patients, all the other things that you're navigating through the day, taking 45-minute chunk out of your day, even though there might not be a patient schedule, doesn't mean there's not a whole lot of
That's right.
interruption and other things that you
Yeah.
have to put aside to get to that time where you're locked into a meeting. And then all those things that have been accumulating while you've been busy then have to be navigated to
Mhm.
get done. That's going
Yeah.
to be challenging.
Yes. Yeah. Yeah. Yeah.
Just like we know that lunch meetings are costly. Our inboxes keep filling up, our demands
Yes.
keep going, even if we're in a meeting.
And I guess that gets back somewhat to choice and what in that moment are they wanting to pursue or feeling drawn to or engaged in. And that's their choice. We're going to hold it all lightly. Coaching, when I was working internally, was never mandated. It was never assigned. It was always a choice of the individual if they wanted to come, if they were going to show up. We did ask for notification if they weren't going to show up, because sometimes then it would mean that someone else could fit into that spot. So we tried our hardest that way. Yeah.
Yeah. Tell me what you're doing now. What does your program or coaching look like at the moment?
Yes. I am an independent contractor. I work very part-time. So I retired 2 years ago. My husband retired at the same time. And one of our loves is to travel. So that's one of our main things that we do. But as an independent coaching contractor, I work with several different organizations to offer coaching both to individual clients and to teams and groups. And I also teach now with the Physician Coaching Institute, where I trained 8 years
Mhm.
ago. And to me, that is a way to really give back to the system. We train healthcare members, it doesn't have to be a physician, whoever is within healthcare and wants to learn more about coaching within healthcare. Part of that is a 6-month program that you can get a certified training in. And I really enjoy that teaching part of it as well. And the enthusiasm, the growing enthusiasm that's out there for learning coaching techniques. So you don't necessarily have to become some sort of certified coach who offers an intense program. Simply learning how to have a coaching conversation, learning how to better listen, learning how to be fully present when someone's talking to you. Those are gifts we can give to our peers that are on short order in medicine anyway, because we're so time and energy short in our day-to-day work. Wow, what would it be like to have somebody fully listen to me for 10 minutes as I'm processing something on my plate about an upcoming meeting or something like that. So there are, I think, are many coaching style techniques that healthcare would benefit from knowing more about anyway.
Got it. And where do people find you if they're looking to connect?
Yeah. So I have my own website, healingedgecoaching.com, and I'm also available on LinkedIn. And I have a very small Instagram presence too. But honestly, probably the easiest way is to search me on LinkedIn and get a message to me that way.
Perfect. What have we not talked about that we should talk about before we end?
I think maybe one thing that comes to mind is somebody might say, what would I go for to coaching for? Just maybe a short list of ideas and topics. It could be around maybe wanting to grow your leadership skills. Maybe you have a different role coming up in your within your department. How am I going to manage that? Maybe you want to do a career shift. Honestly, a lot of providers are coming now. I'm getting ready to retire. How do I plan for that? So big life changes. that whole work-life balance piece. Now I have a busy home life or maybe children and a growing family, and now I have even more and more work. How do I figure that out? And also communication. I do a lot of coaching around communication. I want to improve how I interact with my team. I got some feedback that maybe I'm not as good communicating as well as I could be. And sometimes when individuals are coming for coaching around communication, they already feel a little bit maybe ashamed by how they've been communicating. So sometimes the feedback that we get from our superiors can be less than helpful and resourceful. It might come at us as a sharp arrow of feedback. And so the point is not to highlight that. It's about, where do you want to go with this? You've been given this feedback now. How do you want to move forward? What might your future look like if it was more ideal? So lots of different topics that clients might bring forward for coaching.
Love it. Good. And any messages to people who are struggling in the system right now that you could leave them as they're listening on their journey today?
Yeah. You're never without choice, even though sometimes it might feel that way. So explore possibility and consider what options are available. Still, taking care of yourself is vitally important in there. And I know that can sound kind of cliche, but as much as we hear it out there, there's still a good population of us that don't pause and take those deep breaths and take those moments of reset, even during the day. A simple bio break, a simple snack, a simple glass of water can be that mindful moment. And so taking care of our biology at the same time is vitally important. Yeah, and I think if coaching crosses your path, lots of coaches around to explore that with. Absolutely.
Great. Thank you so much for this conversation, Sue.
Yeah. Thank you, Sarah.
Have a great week, everybody, and I'll see you next time. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.